Kulinda Kenya ni jukumu la fahamu Kenya.
Welcome back. You're watching KTN Prime. Joining us still live is the Acting Director General, Ministry of Health, Dr. Patrick Amoth. Thank you very much, sir, for staying with us. So at least we've been able to cover some issues around mass testing. So now 56% of the COVID-19 patients in Kenya are asymptomatic, and we're still seeing a record of low deaths. But this is still a cause for concern, the issue of asymptomatic patients. How are we shaping policy to address this? Because it would seem still that it is a big risk for Kenyans, even as we try to deal with this pandemic.
Thanks, Akisa. Allow me to correct you. It's actually 72% of all our cases have been asymptomatic.
Oh, great. Thank you.
The 56 refer to those who are in the quarantine facilities.
Facilities, okay.
So out of the 396 patients that we have had, 285 have not had any symptoms. And that is why the policy of mandatory quarantine has been a blessing for this country, because it has made us pick those who otherwise would have moved to the community and continue to pass the infection to other unsuspecting Kenyans. It, of course, has also shaped our policy in terms of our robust contact tracing. Like if you look at the case in Kawangware, where one index case, we could be able to trace 13 contacts that were related to that particular case. And that is the basis of a mantra of test, trace, and isolate, which we are going to continue enforcing in full.
So then, even as we talk about that, a lot of issues around PPEs for health workers. We've seen various protests around this. What is the status of ICU beds? How many do we have across the country? Ventilators. We still seem to not be having enough to handle this, and it's a cause of concern for Kenyans. Just paint for us a picture on how we are handling this by the national government as well as in the counties.
Thanks, Akisa. I know that initially we had a bit of a problem with personal protective equipment, of course, because of global supply chain challenges. And of course, the healthcare workers have raised this issue. However, the supply chain pipeline has since improved. And behind any dark cloud, of course, there's a silver lining. And the innovative nature of Kenyans now, we are able to manufacture some of the PPEs locally. And of course, initially also our distribution was based with a focus on the epicenters, that is Mombasa and Nairobi. Now with the improved quantities in our pipeline, we'll be able to ensure distribution to all the counties. But of course, more emphasis will still be able to, we still put more emphasis on areas with high case loads.
Regarding
yes,
just finish up.
Regarding the ventilators and ICUs, of course, initially we started with the number of about 500 ICU beds. Of course, each ICU bed has a ventilator. But we are also trying to focus more on piped oxygen, because we are also looking at this post-COVID-19 pandemic to ensure that we can be able to have oxygen for all the sick people who will need it. Moreover, indications and studies from the West have clearly indicated that even those who are put on ventilatory support, the mortality rate remained quite high. So we are shifting our focus to be able to focus more on pulse oximetry, to look at the oxygenation and quickly put you on supplemental oxygen to avoid use of ventilators, based on the studies from the West and China. Thank you.
DJ, I should ask you this because it continues to rattle a number of Kenyans, if not most, the issue of quarantining and isolating from contact tracing and whatnot, the issue of financing of quarantining and isolation. Section 27 of the Public Health Act doesn't really talk about who pays or whether the Kenyan himself or herself should be the one paying for this or footing for this bill. Why are we making Kenyans pay for the quarantine period? And what happens in the event one cannot afford to pay this bill?
Thanks, Akisa. Let me first start by defining what quarantine is. Quarantine is basically separation and restriction of movement of a person exposed to a contagious disease to see if they become sick. On the other hand, isolation means separation of a sick person with a contagious disease like COVID-19 from those who are not sick. Remember, even as we handle COVID-19, our agenda of universal health coverage has not died, and that is to ensure that Kenyans have access to affordable, quality health services. Affordable may not necessarily mean free. So these cases we are treating on a case-by-case basis. For those who have not been able to pay, of course, we have always worked out ways to ensure that they leave the facilities. Not only the quarantine facilities, but also the isolation facilities. However, this is a matter that is also under discussion by the National Emergency Response Committee, which will be able to give final direction during our meeting this weekend.
So then do we expect that we will be seeing a number of Kenyans released even if they're unable to pay for having stayed in a quarantine facility for 14 or more days? Are we likely to see that happen?
That has happened on several occasions, and we have letters here from the quarantine facilities addressed to the Principal Secretary, who is the accounting officer, that the following persons are not able to pay, however, their bill was this much. And those people have always been released.
Still speaking on that, about the hotels and them paying for their employees to be constantly tested during this period, even as we are reopening our restaurants, what then happens when a restaurant or an eatery cannot afford this? And isn't this something that would have been budgeted for from the funds that we are getting, or not? Just quickly rush us through how this is going to pan out, even from the meetings you've had from hotel operators.
I think the best way to approach that will be on a case-by-case basis. Of course, this pandemic has had a heavy toll on our economy. And as a government, this is a responsive government which will ensure that all Kenyans are supported to continue to contribute positively towards the development of our country.
So then what does that mean? If a hotel cannot pay, they're advised to not just open entirely?
Payment is the tail end of the process. What is important is the inspection, whether the hotel or the restaurant meets the laid down protocols and guidelines which we have laid down.
Okay, great. Let's talk about Mombasa.
Remember the Kenyans that we have tested, who are more than 20,000, who have been tested in public health facilities. None of them have been told to pay for this service.
Let's talk about the Mombasa factor. With the rise in number of cases being reported for Mombasa, I believe we are more than 100, about 106 currently. From the national government level, what interventions are we putting in place, curating it to Mombasa County to just try and contain the situation, apart from what has been done by the county government already?
Thank you. We have worked very closely with the county government of Mombasa in trying to address the pandemic in the coastal city. And in my earlier statement, I said that beginning tomorrow, we begin targeted mass testing in Vita constituency. Next week, we are also sending a team to be able to support the county to establish and also reinforce their contact tracing system. And of course, we have always prioritized Mombasa in terms of provision of personal protective equipment, testing kits, and sample collection kits.
So then quickly, as we wrap it up, what does our curve look like? What more interventions are we likely to see? And would you say that we are in a good place, we are on the right track as a country in containing this pandemic?
I believe we are on the right track if we continue to maintain what we have been doing, that is hand washing, social distancing, staying at home, physical distancing, and of course, in terms of provision of respiratory etiquette. Our curve looks a bit flatter compared to other countries like the European countries at this particular time. If you look at, like example, Spain and Italy, if you look at the numbers on this particular day, their numbers were much higher. So it is my plea to my fellow Kenyans that we continue to practice all these measures that we have clearly articulated each and every day. Then we shall be able to overcome this challenge.